Hello, welcome back to the Caring Conversation studio, live from the Care Show in London. It's the swelteringly hottest day of the year so far, and we're suffering from it. You wore a summer dress though, so I think you've...
I'm embracing the sun. I love the sun. Yeah.
So do you want to tell us who you are and what you do?
Yeah, so my name's Kathryn Smith. I'm the Chief Executive at SCIE, the Social Care Institute for Excellence. And SCIE is an independent charity that works across all parts of the social care sector. So we work with commissioners, we work with providers, we work with the government, we work with professionals, and everything that we do we try to co-produce with people that draw upon care and support directly. We work looking at evidence for good practice, we develop good practice guides, we provide consultancy and training, we do safeguarding research, and lots of things.
Yeah, a bit of everything. So I guess from your perspective, a bit of a helicopter view of the sector, you know, it's a sector that's perpetually in crisis. Where are we at now? What's our latest crisis? What's going on in the sector from your perspective?
Yeah, I mean, I've worked in social care from being very young. It's all I've ever done, to be perfectly honest. And I think some of the issues that we're battling, we've been battling for a long time. I think we've had an issue where successive governments haven't taken social care as a priority. And we've got to the point now where people are really struggling. More money needs to go into the system. And different ways of doing things needs to come out of it as well. We've got more people to care for than we had before, and in real terms less money to do that with. So we need to be looking at innovative ways of doing that and how we can do that in partnership. How do we work across the different parts of the system? So for example, housing and health, and you know, one of the big things I keep saying recently is that fixing the NHS is a priority for the government, but they won't fix NHS if they don't fix social care. So we really need to look at more innovative ways of doing things in an integrated way.
Yeah, it's definitely, I've always thought it's seen as the sort of poor cousin of the NHS, and you know, that it's kind of ignored and left to the side, but actually without a functioning social care system, it's not easy to get people out of hospital, to get them back into their own home, to get them the support and facilities they need. And the sector is sort of there saying, hi, we're here, we can do, we can help, we can help. So it's frustrating for the sector, isn't it? It
is, and I mean, you know, essentially, for people to be able to live well in their communities, we need good social care to support them to do that. We need the right housing to provide that care in, and then, you know, if people were living well in the communities, they would feel better, mentally better, physically better, and that would be less of an issue for the NHS. But of course, social care is much, much wider than the NHS, but nevertheless that's a really crucial point about how we might be able to fix things in the future. And SCIE have been leading a programme called the Accelerating Reform Fund, which is looking at innovation in the sector and how we can help to learn from innovation, what works, what are the barriers that we're trying to fix, what works, what can make a difference, and how can we scale and learn from those innovative things that are coming up. And there's been some really great things around around the different parts of the country with people working together, but I think capacity to be able to innovate and learn from that innovation is quite restricted. So the Accelerating Reform Programme is to help to bring that out, and you know, digital ideas to support carers, shared lives, things like that. So it's been really quite interesting.
Is there any sort of specific innovations that stick out to you as something you really want to sort of, you know, speak about and say that people should know? Yeah,
I mean, do you know, there's quite a lot, and a lot of them are digital, and I think there's a lot more we could do in the digital space. One of the ones that comes to my mind at the moment actually is something that's happening in Lincolnshire, which is about carer relief and supporting carers and looking at how they can use nature and getting out and doing things in nature to give people a break and support that care relief, and that's really interesting. But another one I talk about all the time is a digital technology called Pain Check. I don't know if you've heard of Pain Check.
Yeah.
And Pain Check uses artificial intelligence to be able to scan the facial expressions of somebody that's not able to communicate. That might be because of dementia or a learning disability or something. They're not able to communicate, and the technology will tell you if that person's in pain, and it takes you through a series of questions to be able to identify where that pain might be and why that pain might be there, so that you can take the right intervention. And what people have found that use Pain Check is two things. One thing is that it reduces people taking unnecessarily painkillers. So they're commonly discharged from hospital on paracetamol 4 times a day. If they're not in pain, they don't need that. But also,
which causes other problems with blood pressure and things like that.
Exactly. And then the other side of that is a lot of people that are in pain and are unable to communicate that pain can end up displaying what some people call challenging behaviours. They can show signs of aggression or frustration, and they commonly end up dealing with that by putting people on benzodiazepines, kind of like antipsychotic, tranquilizing type drugs. And what they've found, some places have found that the use of pain check has helped them to reduce that reliance on those kind of drugs, which means that they're managing people, helping people to keep safe and well. So I think innovations like that are going to be really useful for the sector, but there's a lot of really good work going out there, and I think we just don't shout about it enough.
I think as a sector I think we struggle to cut through, don't we, into the national conversation, because it is difficult, because there is so many things on fire that, that social care is one of those things that just gets swept under the rug a bit. Is there, is there much more we can do as a sector to sort of shout about what we do?
Do you know, I'm really glad you asked me that, because that is something I really think we do need to do. And I've just been having this conversation earlier today, actually. But if you think about the things that are a priority for governments as a rule, things are not a priority for government unless it's a priority for the public. And most of the public know about the other areas. We come across the NHS, we come across education, we come across the police, street lighting and potholes in the road, It's really well known. People don't know about social care until they know about it. And MPs tell us that they're not getting letters about social care in the inbox. And until we lift social care as a priority for the public, it won't become a priority for the government. And actually, the statistics are quite shocking. 1 in 2, 1 in 3 of us will come into contact with social care at some point in our lives, either for ourselves or for somebody we care about. But for many of us, often that's not until older age. And so we don't know about it until it's later. But actually, if we all start talking about social care and understanding it more, write to our MPs, write to our councillors, because we need to make social care the priority it needs to be for the government to take action to fix it.
The amount of sort of posts I see on our local community Facebook group about dog poo versus there's probably tens, hundreds of people in our village that are isolated, lonely, aren't receiving the support they need because it's too complicated or there's not the system's not in place to let them. But it's not.
And it is linking those different parts of the system up. So I support a young man who is disabled, and he's struggling to get the benefits that would enable him to be independent. So he's isolated, he's in his house, he's isolated, he can't get out without somebody taking him out. He can't get to his job, so he's now working from home. He's starting to get depressed, he's getting isolated, he'll probably end up losing his job, he'll probably end up on benefits, he'll probably end up needing social care or some kind of intervention. And actually, if the sections all work together, if you've got the right support in the community, if you've got the right benefits, if he was supported to get out and about, that wouldn't happen,
So sort of looking after people. I think a lot of the time maybe as a society we expect someone else is going to sort out the problem, and and that's not always the case until it's an emergency, and then the state steps in, and at that point, things have probably gone further than they should have done.
And the funding situation is really difficult. We've got a lot of really great care providers that are trying to do a great job, but with less money and more demands on them. And we really need to look at how we can. First of all, how can we get more money into the system? But second of all, how can we make that money go further? How can we be more innovative and work more in our communities and within our neighbourhoods to be able to draw upon different forms of care and support in a different way to be able to get the right solutions for people? And we really need to co-produce that solution with the people that draw on care and support, because there's nobody that knows what will help somebody more than that person.
No, it's really interesting. I mean, it's great shows like this, right, where on display is hundreds of companies that are trying to do things to help the care sector provide better care more efficiently, more compassionately, hopefully for less money as well. And I think there is also a lot of inefficiencies in the system. Isn't there? Really is.
There is, and as I say, kind of people having that bandwidth to think about how to do things differently. It's like the old analogy, they're trying to rebuild the aeroplane while they're flying it, and that makes it quite difficult. So having some space to sit back and think about what the solutions might be, and how can we get that kind of collective interest around the country to make this an issue for the public, that the public cares about and wants to see a change, so that we can really,
Is there a wider sort of innovation or kind of idea that you're pushing for as an organisation from, say, the government or the local authorities around how you calculate funding, or is there Is there a big change that needs to happen? Obviously, you know, they've kicked the social care white paper another 2 years into the future. I don't know why. I guess because they don't really want to deal with it. And like you said, it's not in the MPs aren't getting hounded by it. Is there something that should be done at that level?
I think one of the questions that we need to answer first is, what is good social care? What does good social care look like? And how will we come about a set of national standards that we can strive to? We need to make sure our workforce are valued, recognised and paid well to do what they do, so that they don't go to leave to work in McDonald's or Sainsbury's because they can get more money. You know, people that come into social care have got a vocation. They want to work in care. They want to do that. We need to make that be rewarding for them. So that, you know, that's one of the issues. But we're kind of moving along from that. How are we going to describe what good care looks like? Because one of the things I find quite fascinating in my role, I go out and visit different services around the country, and expectations are very different in different parts of the country. You know, in more affluent parts of the country, expectations are really, really high. In some of the less affluent parts, they're just pleased to be able to get a service. You know, and so how will we decide where that national level sits? What does good social care look like? And I think that we need to have that national conversation. We need to describe that with people that draw upon care and support, and then use that as a benchmark to set the standards nationally, and the implementation, how we're going to get there. And hopefully we won't have to wait till 2028 before that happens. Hopefully the interim report we promise next year will, because we know most of the answers to these questions. We've lots of reports. We need to be able to move these things forward.
Well, thank you very much for coming in. It's been great to meet you, and thank you very much.
Thank you.
We'll be back shortly.